Hi, Dr. Zeshan. We're back for another opportunity to ask really important questions. And today I am wondering, how should parents consider, when should they consider seeking professional help if we suspect that our child might have OCD, and what type of professional is best suited to diagnose and treat OCD?
I think, as I mentioned before, so there's a difference between a symptom and a diagnosis. So let's say you notice that your child has been having significant, just to recap, significant obsessive thoughts, intrusive thoughts, unwanted thoughts. The child is telling you, I don't want to think about it, we just keep coming. And in order to stop those thoughts, the child is engaging in different behavior, washing hands, checking the door, wiping themselves multiple times, taking longer bath, keeping things in a certain order, and that is impacting their day-to-day routine. So at that point, it's very important to get professional help. There is so much stigma about mental health, and getting an help doesn't mean that something you are doing wrong. Doesn't mean that something is missing out in your child. Is just like any other medical illness, when we need help and we can see so much improvement. So one thing, and the other thing is, that you don't have to agree as a parent, with the person. If you don't feel like the psychiatrist or a therapist or a counselor, you don't feel like a good vibe, there are, so many people out there. So those are a couple of things, just want to say it out loud, that you know your child the best, but you have tried everything, but you're going to someone, a professional, and that professional, if making you feel, this is your fault, you have missed something, or you don't know what you're doing, I would say, you don't have to push yourself. So whenever, as I mentioned, whenever those symptoms are happening consistently in multiple settings, school, at home, impacting day-to-day functioning, at that point, it's important to consult professional. Those professional could be psychotherapists, counselors who have expertise in cognitive behavioral therapy, exposure response prevention. So these are, some of the specific treatment strategies that people work with, someone who's struggling with obsessive compulsive disorder. Similarly, if you are in therapy and things are not getting better, then you consult psychiatrists, child psychiatrists, adult psychiatrists who have expertise in it. And there is, the if you there are some association on the obsessive compulsive disorder, international association. So you may find some of the resources out there. National Alliance on Mental Illness, NAMI, has a lot of resources for parents. So you're not alone in this journey, but don't hesitate, because Dr. Google, you found someone, we went to this professional and that professional made me feel this. Don't feel being embarrassed, judged. You have control on your child. Just getting more help is just to help you as a parent become in a better position to help your child.
Thank you so much for that. That's so validating to hear for myself as a parent, and I can imagine for the others that are watching this as well, to empower us to remember that we are involved in our child's health care, and we're doing the best that we can to find them the professional that's helpful. So
Mhm.
it's very just empowering to hear you say, you know, look for someone else,
Yeah,
ask the questions. If you don't feel good, you know your child best, go
I agree.
find someone else, look at some other resources. So thank you for always being one to empower us as parents and to validate that we do know our children best. So thank you so much for your time, and as always for your wisdom.
No, thank you so much for having me.